Welcome everyone, and thank you for joining us today in this panel discussion organized by OVE, the Office of Evaluation and Oversight of the IDB Group. This is part of the Global Evaluation Week 2020. Before we start, I would like to let you know that our discussion today will be in English, but we are providing simultaneous interpretation in Spanish, Portuguese, and French, the official languages of the Inter-American Development Bank. To select your language, please click on the world icon at the bottom of the screen and choose the language that you would like to hear. In this session, we will be discussing lessons from evaluations that have assessed how three international agencies, UNICEF, the World Bank, and the Asian Development Bank, have responded to past health crises such as the Ebola and avian flu. The goal is to provide project managers, policymakers, evaluators, and the public at large with insights from rigorous evaluation of past public health crises that can be relevant for the current COVID-19 pandemic. The discussion is particularly relevant for the Latin America and the Caribbean. The LAC region is expected to become the next COVID-19 hotspot. As now, 16% of the world known COVID-19 cases are in the region. The Pan American Health Organization, PAHO, stated in May 30 that this is the new epicenter, while CNN reported the same day that Latin America now stands as the world's sole region where the outbreak is unequivocally reaching heights. Brazil has more than 500,000 confirmed cases, the second largest number after the US. Peru and Chile have reached more than 100,000 cases. Finally, COVID-19 is extremely damaging in a context of inequality, large informal sectors, and underinvestment in public health sectors and public debt. So we are fortunate today to have with us three panelists with substantial evaluation experience relevant for the COVID-19 crisis. Allow me to introduce them. First, we have Beth Plowman. Beth is Senior Evaluation Specialist at the UNICEF Evaluation Office. She has over 30 years of experience developing and leading both independent evaluations and monitoring systems for global health programs. Beth led the evaluation of UNICEF response to the Ebola outbreak in West Africa 2014-2015 that we will be discussing today. She joins us from New York today. Welcome, Beth, and thank you for joining us. Stephen Hutton. Stephen is a Senior Evaluation Officer in the Sustainable Development Unit of the Independent Evaluation Group of the World Bank. He has conducted evaluations of the World Bank activities in environment and environment-related sectors since 2009, as well as policy lending and pandemic preparedness. He led the evaluation responding to global public bads, learning from evaluation of the World Bank experience with avian influenza 2006-2013. This will also be part of our discussion today. Stephen joins us from Washington, D.C. Welcome, Stephen. Thank you for joining us. Finally, we have Maya Vijayarajan, and I'm sorry if I don't pronounce your last name correctly. Maya, we know each other for a long time, and I still don't know how to pronounce your name. Maya is Principal Advisor, Evaluation Specialist at the Independent Evaluation Department of the Asian Development Bank. She worked for most of her career with the U.S. Centers for Disease Control and Prevention, CDC, where she led impact and economic evaluations of international health programs at global, regional, and country levels. Maya co-wrote the Asian Development Bank synthesis note responding to the novel coronavirus crisis, 13 lessons from evaluation. She joined us from Manila today, where it's close to midnight. Welcome, Maya. Thank you for joining us at this very late hour for you. Before we begin with the questions to the panelists, I'd like to explain the format of the session. First, I'll ask each one of the panelists a set of 2 questions regarding their specific evaluations. After that, I'll ask one more question to the 3 panelists. And we will have 15-20 minutes for a Q&A session with the audience. An important note to the audience, please write your questions on the chat. You can use any of the 4 languages of the IDB, English, Spanish, Portuguese, and French, to write your question on the chat. One of my colleagues will be collecting the questions and we will broadcast and pass it to the panelists. The questions can be sent at any time during the panel. So without further delay, let me begin with a question for Beth. Beth, your evaluation is about UNICEF support to countries during the Ebola crisis. Can you please tell us briefly, how did UNICEF respond to the crisis, and what is particularly significant about this response in the current COVID-19 context?
Thank you, Ivory. I'd like to start by, I do have a few slides to share, and I'll start by basically recapping a bit what the approach was that UNICEF used for the Ebola outbreak. I'm sorry, I'm juggling a little bit here. Okay, I hope you can see that. So what I'd like to talk a bit about first is the fact that in early 2014, of course, when this outbreak first started, the UNICEF country offices in the 3 affected countries, Guinea, Liberia, and Sierra Leone, began responses to the outbreak alongside and simultaneous to their regular country programming. By September of 2014, UNICEF had declared an L3 agency-wide emergency. And that basically enabled the organization to rally its resources and also to expedite many of its processes and procedures. And that response was sustained through 2015. So UNICEF responded to the crisis primarily through 3 objectives. The first was to bring the outbreak under control, basically by contributing to larger system-wide goals for early isolation and safe burial in each of the affected countries. Now, UNICEF made that more operational at its program level by basically issuing guidance that was focused on a community approach to behavior change. And that approach was focused on reducing transmission through isolation and care of patients at community care centers, and building trust with communities by mobilizing and empowering them as partners. The second goal was to prevent other high-risk countries from suffering major outbreaks. And finally, UNICEF sought to support early recovery and initiation of building back better primary healthcare systems and other social services. So just to sort of give you an overview in terms of what this looked like in regards to expenditures, this was nearly $500 million response over that period of time. Not surprisingly, led primarily expenditure-wise by the health section, followed closely by WASH and Communications for Development. And then looking to sort of the line items, you can see that the majority of the funds either went to supplies and commodities, which is a huge part of UNICEF's response, as well as grants and transfers to partners.
Thank you, Beth. Yes, exactly. Please go on.
Sorry, I'm sorry. I'm trying to regain control of my computer at the moment. Are you able to hear me? Yes, okay, perfect. So then a second part of this question dealt with what was particularly noteworthy about that response in the current COVID context. And I think the point that I would like to make is that UNICEF is a large and decentralized organization with a broad mandate to advance and uphold the rights of children. So the response was challenged essentially by differing understandings of what the Ebola-related risks were and also about the rationale for intervention. Now, a lot of this comes down to what I had pointed out previously on the slide about prioritizing a halt in transmission. There were others who saw that within the organization as falling short of our commitments to the broader welfare of children. And in particular, I believe, felt that we were perhaps late or delayed in addressing those broader needs. Our regional staff in particular, who obviously were key in this response, felt that the overall response was perhaps too medicalized, which is something that you hear even today, and for example, the outbreak in DRC. It really didn't take fully into consideration in a timely manner the important risks and other effects of the outbreak and its response on children. So I'd just like to stop there and basically say it presented a challenge to us internally because of our mandate. Thank you.
Understood. Now, perhaps you can share with us, in addition to this, 2 key evaluation findings that you think are relevant to the COVID-19 response today.
Okay. All right. That's great. Thank you. And sorry, just to confirm, were you able to see when I shared screen? No. Oh, sorry.
I think we were not able to see the slide.
Okay. Sorry about that. Sorry about that. Okay. So there are many lessons, but I've tried to identify 2 as particularly pertinent here. And the first one really deals with the finding from the evaluation that UNICEF's response was neither promptly or adequately addressing the Ebola's humanitarian and socioeconomic consequences for children, related to the point that I had made above about what was noteworthy about that first response. So the context of this is that children were disproportionately impacted by the Ebola outbreak. Children comprised 1 in 5 of all infections, and those under 5 years of age had an 80% mortality rate. But beyond the illness itself, children were impacted by school closures that lasted anywhere from 5 to 9 months. Ebola overstretched critical health, nutrition, and wash services, and really severely impacted the ability to continue national activities focused tackling measles, malaria, and other diseases. So there were very important disruptions to the service continuity here. And as a result, more children died from non-Ebola causes due to the disruption of health services. So I think that's an important fact to bear in mind. So our response strategy, as I had mentioned previously, it faced some internal growing pains, perhaps. It really related to how do we integrate our programs and how do we sequence our programs. Remember, we're a broad-based agency. We're looking at health, we're looking at education, nutrition, child protection, social protection, water. So it's how to really mobilize so that those resources are brought to bear at the right time and in the right way, particularly in accounting for the broader socioeconomic impact. And so what's relevant about that finding today is that UNICEF, as it has even started initiating its response, has put the longer-term socioeconomic impacts really at the forefront of the agenda. So it's a really important aspect of the way that we're looking at our response today. So that's one key lesson. The second key lesson I'll just move into very quickly, and again, this is based on a finding from the evaluation, and that was basically that UNICEF and its partners struggled to reinforce basic services. in the wider recovery effort. And this was unfolding during a period in which there was not adequate levels of funding. And as a result, these national health systems remain vulnerable to public health threats. So during much of 2015, UNICEF worked to reinforce primary health care, and it undertook activities to continue immunizing children, training community health workers, integrating, Ebola prevention activities, IPC activities for health workers, and obviously providing supplies to health facilities that were affected by this outbreak. UNICEF also invested in developing national recovery strategies and plans, which they were fully aligned with, but unfortunately found that those plans did not attract the funding expected. And as a result of that, some of the types of results that we might see today in regards to those health systems, I believe that we can conclude that they remain vulnerable to these types of threats. Now, bringing that to today, why is that relevant? In part because, again, we've incorporated this focus on service continuity from the very beginning of the response. So we're very focused on making sure that life-saving services for women and children continue, and in particular that we integrate more of a system strengthening approach in the way that we go about these, responses as an integral part of what we're doing. So I'd say those were the two major lessons learned that I'd like to share with you today. Thank you, Ivory.
Thank you, Beth. It's extremely interesting, particularly the fact that this need to identify what are the populations or groups that are disproportionately affected by the pandemic. And that's a point that we will probably come back on the other evaluations and the other studies. And also the question of the recovery and how we ensure the reinforcement of basic services. But I would like to move on to Stephen. Stephen, your evaluation was about the World Bank's response to the avian flu. Could you please tell us briefly, how did the World Bank respond to the crisis? And what was particularly significant about such response in the current COVID-19 context?
Thanks, Ivory, so much for inviting me here today. I'm really grateful for the opportunity to share some of our experience based largely on work we did about 7 years ago, looking at the World Bank's response to avian influenza and the evaluation that you talked about earlier that we carried out on this. I think it's important at the outset to describe what's different from the H5N1 avian influenza outbreaks versus where we find ourselves today. So highly pathogenic avian influenza outbreaks ended up being largely limited to poultry. So while there were outbreaks across 63 countries, there were only a few hundred documented cases in humans from direct infection from poultry, from birds to people, and less than 300 identified human deaths. So the fear was that the virus would mutate into something that would be transmissible between humans, triggering a global pandemic, but it didn't happen. So today is the nightmare that everyone was trying to prevent. So much of the work on the evaluation was looking at control of zoonotic diseases in animals, for which then the relevance under COVID-19 is limited in the short term, right? We're now in a human pandemic, though it remains relevant in the longer term for preventing future zoonotic disease outbreaks. Let me talk a bit about the bank response. So the international response was significant, and the World Bank played a key role. It rolled out dozens of avian influenza control and human pandemic preparedness projects across 62 countries, including more than $800 million in activities relating specifically to avian influenza and zoonotic diseases, roughly half financed by the World Bank, mostly through its core IDA-IBRD lending, and partly also through a multi-donor trust fund. Supported both animal health and human health activities, largely capacity building for surveillance systems, diagnostics, outbreak response and control, and human pandemic preparedness. This included things like laboratory construction, equipment and training, support for agricultural extension programs, creating disease reporting and monitoring architecture, public awareness programs, and limited degrees of sort of hospital upgrading and support. In terms of what was noteworthy, so one thing that was noteworthy about the response was the effort to set up an overarching program of response rather than just individual projects. So the World Bank established this high-level program design with a broad template and a menu of options of eligible activities that could be included. And then client governments in consultation with experts and bank teams could select from the list rather than going through a detailed preparation process for each project individually. So this helped with approving a large number of projects quickly and also offers possibilities for COVID response projects, where again, we'll see many countries all struggling with similar challenges. So both responses have also relied substantially on restructuring of existing projects, and so gaining from the ability to build on existing platforms and implementation units that are already up to speed and able to act quickly. Another factor then was the central role that partnerships took. So the World Bank had, of course, substantial program management capacity and experience, but it lacked the technical expertise on animal health or pandemic preparedness. I think there were 2 veterinarians in the World Bank at the time. Partnering with other technical agencies, especially the Food and Agriculture Organization and the World Health Organization, but also the World Organization for Animal Health, was really crucial. UNICEF was also involved, especially in communication activities and awareness raising. So the World Bank acted in many ways as a convener between these and other agencies, which often didn't have much previous experience in working together, especially across the animal health and human health sides. Strong support from senior management in all of these organizations was critical in getting partnerships to happen. Evidence from some of our other evaluations shows us that this kind of partnerships also contribute to mitigating risks that come otherwise from rapid preparation. This is really critical for COVID response, given the urgency we face. Thanks.
Thank you, Stephen. Equally, as for Beth, I would like to ask you if you could please share with us 2 key evaluation findings from that evaluation that you think are relevant for today's crisis, COVID-19.
Thanks. Let me give 2, one kind of specific and then one more general and strategic. So there are a lot of specific findings around the challenges of building laboratory capacity for testing that might be relevant still for a COVID response. So the menu-based design system meant there was often a lack of specificity at project approval about which specific upgrades would be made, right? Which sites, which facilities to what kind of standard. This caused a lot of challenges then in implementation and a lot of delays. So there were many difficulties in particular with attempts to construct biosecurity level 3 laboratories and concerns about whether these would be economically feasible to maintain and operate. Projects faced a lot of difficulty with procurement for laboratories, especially for highly technical equipment. It's easy to imagine that being even more of a challenge with COVID response projects, given the global shortages of critical equipment. So a degree of upfront realism would be important. Projects sometimes focus too much on the hard kind of works, right? The physical laboratory infrastructure and equipment, rather than on the soft systems, the systems development and human capacity, or thinking through kind of their service model of how they would function and operate. It was dispiriting sometimes in our field work, going to the field and some years later and finding, empty labs with boxes of equipment that had never been packed and things that had never become operational because of a lack of a clear service model and insufficient human capacity for operating them. On the big picture, so the evaluation's main finding was first on the success of the response itself, right? Where the World Bank really showed its strengths and its ability to use its convening power to mobilize funds, to work with partners, and to rapidly prepare and supervise a global investment program, even in an unfamiliar area where the bank lacked expertise. But its second finding was on how support for zoonotic disease control and pandemic preparedness was not sustained. So as avian influenza and then the 2009 H1n1 pandemic, influenza pandemic, turned out to be less serious than initially feared, though it still killed 500,000 people or so worldwide, the international community moved on. So donor priorities shifted to the global food crisis, the financial crisis, the broader economic downturn. The World Bank largely stopped new pandemic preparedness projects after 2010, when the trust fund was fully committed. The World Bank has supported, since then, a pandemic emergency facility, which we haven't evaluated, but has been controversial, and Ebola outbreak response projects, but it has not mainstreamed pandemic risk reduction into its health sector interventions until starting that now in COVID response. And I think this gets at a fundamental challenge for the international development community. So we're often very good at responding to crises when political interest and client demand is high, but we struggle to remain engaged when the spotlight moves on. Collectively, we find it hard to set and sustain priorities as we tend to keep taking on new issues. At the World Bank Independent Evaluation Group, we've just released an evaluation on the global role of the World Bank, which discusses these issues in depth. Thanks.
Stephen, thank you very much. Those are very interesting remarks as well. The question of the preparedness and how is it sustainable and how we can sustain it. I think it's a point that we should come back to. But let me turn to Maya. Maya, your 13 lessons from evaluations is a synthesis note rather than evaluation per se, and it focused on COVID-19, so, or at least on the learning for COVID-19. Could you please tell us what motivated the note and how did you select the evaluations to draw from?
Thank you, Ivory. So to answer that question, I need to take you back to early January. As you know, the first case of an unknown pneumonia was detected in Wuhan, China, and was first reported to the WHO country office in China on 31st December 2019. And the first situation report that the WHO issued was actually on January 21st. And within about 10 days from then, which is around 30th January, the disease has spread to about 18 countries, spanning all the way from Australia to North America and including Europe, right? So we saw that the situation was evolving very rapidly. And I think at that point, we recognized that the spread could accelerate and that governments and partner organizations like ADB in the region would need to respond very quickly to the crisis. And so we believe that past evaluations of the response of both financial and technical agencies, which includes, us, the World Bank and other regional development banks like IADB and the African Development Bank, as well as technical agencies like the World Health Organization and UNICEF. So we thought all of these evaluations could provide useful lessons on supporting the response to COVID during and after the critical phases of the outbreak. And so it's just around early February or so that we started work on this synthesis note, which we intended to be a just-in-time lessons note. So since it was meant to be a just-in-time synthesis note, really the selection of evaluations, we just started with a really quick search to identify evaluations of all the multilateral development banks and other multilateral partners, both financial and technical responses to previous, smaller crises. Obviously, in retrospect, the avian influenza crisis, the SARS outbreaks, and the Ebola outbreaks in Africa. And in addition to that, we also reached out to the African Development Bank's Independent Evaluation Office, mainly to ask them for evaluation documents that we really couldn't find on their website, because we wanted to get a better sense of how the African Development Bank responded to the Ebola outbreaks in West Africa. So that really, was the motivation. That we saw that it was rapidly evolving. We knew that it was going to spread. Of course, at that time, we had no idea it was going to be a pandemic, which is the situation that we are facing today. So I think that's pretty much all I'd like to say in terms of both the motivation and the selection of the evaluations for the just-in-time notes.
Thank you, Maya. It's very interesting, and of course, you were in a privileged position, being covering Asia, the region where this pandemic started to be seen more clearly, and were very quick on reacting to it. So yeah, I can understand also that this fast response needs to make a balance between if you want to go quickly to have this kind of synthesis, it needs to be balanced with a more sophisticated approach that you could take on other occasions in order to select the studies, etc. So that's great. But tell me, if you look back at all those studies that you revised, could you share with us 2 key lessons that, not based on the World Bank or UNICEF evaluation that we have discussed today, that you could think are relevant for COVID-19?
Absolutely. So the first one is really, if anyone has looked at the 13 lessons, first one would be lesson 9, which is something related to, more of a medium-term concern. It's not an immediate concern, but medium-term, which is on sustainability of the disease surveillance systems. I think Stephen touched on it, but we also found this in parts of Asia as well as with Ebola in Africa. So, the main issue is really addressing the challenge of sustainability after the crisis response funding ends, right? So what happens, to all those, to all that lab capacity that was built up and all the diagnostic testing that was done. So what we found was that in some countries, the laboratories were located within university teaching hospitals. And they also included diagnostic testing in the curriculum. So this could be a useful model, to both in the current crisis and for the future, to train future laboratory experts, and also to maintain the surveillance systems through the participation of those students to actually do the work. Another example we found in Mali, where medical students who were trained in epidemiology were used for contact tracing of Ebola cases. And this could be one useful model, especially since contact tracing becomes a bigger part of the response to COVID-19 as we move forward, in the next few weeks to months. The other lesson that I don't think featured in either the IEG report or the UNICEF report was on actually considering establishing a Center for Infectious Disease Control at the regional level in Asia. This is particularly important in the longer term to improve surveillance, emergency response, and prevention of infectious diseases in the future. And in addition to these functions, this center could also serve as a platform for sharing knowledge and for building capacity across countries in the region. As you know, the African Union now houses the Regional Centers for Disease Control for Africa. And I think a similar setup could be considered for Asia. So that was one of the lessons we drew from a quick review and the synthesis note. And just as an aside, I want to add that had we prepared the synthesis note just a month later, when it became clear that the COVID-19 was actually a pandemic, we would have reached back a century for lessons from the 1918 flu pandemic. And as we've seen, that pandemic had some very useful lessons that are actually being applied now. And that would have been a useful addition to the just-in-time note. So I think I'll just stop there, Ivory.
Oh, yeah, that's a very interesting and important remark. There are differences between an epidemic and a pandemic, and that's what we are seeing today, especially in the context of globalization. But also the question of the need for regional centers as much for an international, to keep the international cooperation in order to be prepared for future crises is extremely important. So now I'd like to ask, having heard about each one of those three studies, two evaluations and a just-in-time knowledge node, I would like to ask you the following question. On Stephen's evaluation, we had a quote that says, political support for pandemic risk reduction and preparedness may be difficult to obtain without further serious outbreaks. And that sounds as a premonitory word. My question to you all is, what do you think your respective institutions have learned from the responses to past public health crises and from the findings of the evaluation of those responses? How do you see this learning reflected in the current response to COVID-19? If I may start on the same order, Beth, please.
Sure. Thank you, Ivory. There are many, many lessons, and many of those have been picked up and acted on by the organization. There's one in particular that I'd like to share with you, though. And this really is coming from a lesson learned about our C4D approaches. So early in the Ebola outbreak, many of the C4D and communications approaches were focused on providing information in a rather one-way direction, simply providing information. And over time, we saw that those approaches were not entirely effective. And there were some significant shifts made in the approach by the end of 2014, which really focused more on greater dialogue with communities and the mobilization of community volunteers to basically support and assist with the response. So it really shifted much more from sort of a classic IEC C4D approach to something which was really much more about community engagement. Now, that's one of the things that drove that, and this is the lesson that I'd like to bring forward. One of the things that drove that was basically the involvement of medical anthropologists and social scientists. So as a sociologist myself, I'm very pleased about this finding. But they were found to be very useful in regards to, better understanding communities, drivers, motivations, and therefore how to communicate and engage with communities. Really, people found it to be a game changer, I would say. So let's bring that forward a little bit. In the DRC outbreak, the Ebola outbreak that started in 2018 and continues to this day, UNICEF has basically worked very closely with the Ministry of Health to develop what is a social science research platform. And that platform basically works on a real-time basis, providing analyses and input to decision-making in the midst of these outbreaks, which is, I think, a really, really valuable type of information, which was previously not available. So what the social science research platform has done, for example, in DRC, they were conducting almost 60 field studies during the outbreak of Ebola in DRC. And again, there's a mechanism for which that feeds into decision-making. That whole platform now, because it's been created, it can indeed be mobilized and focused on COVID-19, which is one of the steps that they're taking at the moment. So just to sort of recap, it was the learning about C4D approaches and the fact that that was informed by greater involvement of social scientists, which continues to this day in a more structured and resourced fashion. Thank you.
Thank you, Beth. Perhaps Stephen may follow.
Thanks. So, I mean, I think the main point would probably be what I talked about before, the difficulty in sustaining attention to critical agendas like pandemic preparedness is a lesson I don't think the World Bank or others have learned. It's not that the problem isn't known, it's that it's driven by systemic factors. The incentives for political leaders, both in donor countries and client countries, are often to address the urgent headlines of the day. Priority setting is genuinely hard when there are so many challenges and interest groups addressing each one. One reason the pandemic preparedness agenda almost completely disappeared from the World Bank was because it didn't have an established staff constituency. It didn't have pandemic specialists or animal health specialists on staff. And so the attention that it did get in the creation of the Pandemic Emergency Facility was because this was a particular issue of concern from the World Bank president at the time, who came from a health background and made this a priority issue for him. But you know, there are so many development challenges in the world. There isn't a simple solution to trying to pick out and sustain attention. And when we try and sustain involvement in all of them, we end up stretching ourselves too thin and ending up often with shallow kind of interventions that aren't deep enough to get the kind of results we need. One area, though, that I think the World Bank and others have gotten better at is trying to use interventions to address both urgent needs, but also to contribute to building resilience. In the context of natural disasters, for example. So the World Bank has really moved from 15 years ago, a reactive and reconstruction-oriented approach to emergencies, then to one that increasingly built in risk reduction into those emergency response operations, and increasingly now to an approach that builds relationships and credibility and engagements that then lead to standalone non-emergency operations seeking to reduce vulnerability. And in a few cases, working on broader kind of mainstreaming of multi-sector resilience ideas. And there's a lot that you can do under non-emergency circumstances that is just not realistic to expect to be able to manage in an emergency response operation and context. Thanks.
Thank you, Stephen. Yes, that's as much as we can all understand the reasons why certain factors make it that it's no longer a priority at a certain moment of time. Probably what we have today will make us think again about the priorities that we as institutions need to set. But I would like to listen to Maya on the same topic.
Okay, thank you very much. So I think in terms of what the ADB as an organization has learned is really, how to respond better. And that learning has come not just from past public health crises, but also from, very quick responses to other crises in the region, like the tsunami, the floods, volcanic eruptions, earthquakes, you name it, we've seen it in Asia. So the learning in terms of improving operations has come from all of these. And ADB has adopted what they call a one ADB approach. And the idea behind this is really to harness the expertise from across the institution to help prepare ADB support to the country government responses in the region. So letting the government drive the response, but really providing the support that they need to make it happen. And on the operations side, this has led to some streamlined processes for both preparation and approval of ADB financing. And using this one ADB approach, ADB is actually very quickly approved approximately $9 billion in funding to support the country government response. And it's been a mix of things. It's been public health projects, it's been emergency assistance, as well as some counter-cyclical budget support for operations. So that's on the operations side. But it's not just ADB operations that has learned, the Independent Evaluation Department has also learned. And the way we've tried to support ADB's response to COVID-19 in the region is really in 5 different ways. First is we've been trying to provide some real-time input. So we have a small task force that's providing real-time review and commenting on all the operations that have been proposed. So that's one way. And then we're also planning for an early stage assessment. So basically, we're already planning to undertake an early stage evaluation of ADB response to the pandemic and try to deliver it sometime in 2021. And to make this happen,
I think we have lost Maya. Perhaps Enrique and our support team will try to check what's going on. But while we get back to her, perhaps I would like to come back to the other panelists. We have some other questions. So perhaps I would like to understand, because here we are getting to how the institutions can get, should prepare, how they can react, what are the areas in we should be focusing, and I think there's a lot of learning oncoming. Now, one of the questions I had for you is regarding knowing that responding to a crisis requires fast and decisive action, and very often under substantial uncertainty of what will work or not, makes that the learning and the adaptive learning is imperative. So based on the evaluation work, and I think that's something that Maya was explaining, I understand when she would froze, is based on your evaluation work, what do you think is key to allow for adaptive learning in a situation like COVID-19 response? Beth, please.
Sure. Thank you, Ivory. So in regards to adaptive learning, I guess what I would say is that I don't think you can really have meaningful adaptive learning without adaptive management. And that adaptive management piece is entirely determined by organizational culture and mindset, and in particular, risk avoidance. And so this is an issue that we face oftentimes with the, you know, as you're saying, move quickly, make decisions quickly based on the available information. And there are many who simply aren't comfortable taking the risk to do so. And so that's something that we're grappling with. And I think it really is something of a cultural mindset. Now, one thing that has happened in this regard is that we have indeed launched a learning-focused evaluation, which really is aimed entirely at bringing forward what we're calling good enough information for what are the key decisions that are facing UNICEF at the moment. And so that's actually something that we've just launched within the last couple of weeks, and I hope you know, within the next couple of months we'll be able to come back with, you know, much better description of, you know, the mechanics of adaptive learning and management in this context. Thank you.
Thank you, Beth. Stephen?
Thanks. So, I mean, I think we're going to see so many different kinds of interventions in sectors, given the severity of the crisis. It's hard to be, you know, pull things out that are going to be relevant for all of them. But let me give sort of two particular things. So one as something very specific that came up from our evaluation in the avian influenza experience was the need for real-time learning on communications and public awareness programs, right? Attending to try and influence behavior change. So this was quite critical in several of the avian influenza response projects, having studies done, many of them in partnership with UNICEF, that showed which messages, which platforms were being effective in changing behavior. So with survey response as well, right? Asking people about behavior change, asking people where they'd seen messages, you know, so getting an understanding of which kind of different media or platforms, be it radio, be it pamphlets, be it training sessions and so forth. And so allowing for recalibration or adjustment of those programs, right? In some countries, the training school programs for school children were particularly useful and effective because they created the sort of virtuous cycle where kids would take things home back into their families, and families would then be kind of building on encouraging and trying to help do these things that kids had learned in schools. Something more general then, A suggestion I would give to institutions is to try and practice emergent learning. So in particular, the practice of before action and after action reviews. So a before action review is an opportunity to discuss in detail what success will look like to establish intended results and identify potential pitfalls. And then an after action review can build on this and can be used at pivot points in the operational cycle to extract lessons and shift tactics. And it's most effective when all the team members are engaged in the process. The idea is for this to be an informal process, so closed door, safe spaces that allow for contestability, for candor, rather than necessarily expecting learning to come from more of the more formalized evaluation processes that comes often tied into accountability functions. And you know, picking up from you know, what we're hearing before about sort of risk aversion, right? I think we have to think as well about the role that our evaluation systems and functions sometimes have in partly contributing to that risk aversion, right? And so check ourselves as evaluators to make sure that we're you know, balancing kind of you know, learning and accountability functions, and that we establish ourselves with a reputation of constructiveness and trust, that we aren't, you know, part of the problem in terms of making people fear consequences of things that turn out not to work the way that they expected or hoped they would. I'll leave it at that. Thanks.
Thank you, Stephen. Indeed, a very important point that comes absolutely across is how to balance or what should be the approach for us evaluators in terms of a culture in which takes more risk, is innovative, and is reacting quickly to a crisis. But we have Maya back. Thank you, Maya, and I'm sorry, I understand you had some connection issues.
Yes, and I dropped off the video, I believe, and then the audio. I don't know in what order it happened, but I'm happy to be back. And just, you know, I may drop off again because there are problems with bandwidth in Manila. So I was glad I didn't drop off for nearly an hour. And I might maybe turn off the video if you all don't mind, just to conserve bandwidth. So I'll at least be able to join by audio. So where were we? I think I dropped off and I was halfway through maybe enumerating what the evaluation department has learned, but I'm sure we're past that stage now. Are we on the adaptive learning bit?
Exactly, but I think those are quite related issues. So just we would love to hear, with or without video, your thoughts about what we have learned, how it is reflected on the current crisis, and what we have learned about the adaptive learning that we need for situations like this.
Okay, yeah, I'll be real quick. So I think the real issue in these cases is really a lack of sufficient feedback during the implementation phase of the response. So that's, I think, a real challenge. So I think particularly for the COVID-19 crisis response, I think a real-time feedback during implementation about whether the program or policy works, why or why not, and what can be done to improve it. I think that would be really useful, and that would be, you know, in a sense, the adaptive learning that's going to be appropriate for this particular situation. So I think I'll stop there.
Thank you, Maya. Perhaps I have still questions for you panelists, but I think it's important that we let the audience also ask you their questions. And I have a first question to Beth from Eleonora, asking if UNICEF leveraged any particular innovative approaches during the Ebola response. There is another question for Beth as well, so I would like to put them together. So Kathleen is asking to please share one finding about the non-health or non-medical aspect of the response that affected children the most and its implications for the COVID-19 response.
All right, okay, thank you, Ivory. So I think that, sorry, I'm just finding my notes here. So in regards to the first question about the non-medical aspects, I had an example that I wanted to provide that dealt with child protection. So, you know, these are child protection in this context. These types of services would include psychosocial support for families. It would include both family tracing and reunification efforts, and also particularly to the Ebola outbreak, basically a safe place for children who have been exposed or potentially exposed to receive care if they are not able to be with their families or in their community. So in the summer of 2014, when the Ebola outbreak was at least in its first several months, there indeed were efforts underway to identify needs and to assess partners, local partners who could assist with implementation of this work. So that work was really well underway. And then a bit of a pause happened. And again, this goes back to sort of, you know, the prioritization and the sequencing of the different types of interventions. And so those actual interventions then really didn't get up and running until about 6 months later, when they were adequately resourced and staffed. So that's the type of activity that was delayed, and the type of activity which obviously is relevant and key in today's outbreak as well. The second one was about the innovations. So I guess what I would point to in regards to leveraging innovations, the first one that would come to mind would be the work done by the UNICEF Supply Division. And there was a lot of work done during the outbreak, basically to understand needs regarding, for example, for personal protective equipment, for PPE, to understand what the needs were and what the use situation would be. And so the supply division was very, very active, basically in mobilizing the private sector to innovate in this area, so that the types of products that were available would be more suited to the outbreak. So that's one form of innovation that was used. And leveraging as well. A second form of innovation that was used throughout this response were different forms of digital platforms. And I think the one that I sort of recall that I think is very useful is, it basically was a digital platform that allowed school administrators to communicate with one another and with suppliers and with the Ministry of Education in regards to preparing schools to reopen. And so, for example, this is an area where, for example, you know, our WASH efforts come together with our education efforts to make sure that all schools have hand washing stations. They've got thermometers. They've got the ways and the means to make the educational experience safe for children. And so having this application that allowed teachers and school administrators to very rapidly say, we're out of hand sanitizer, or, you know, we're not getting these types of supplies, or, you know, parents are still reluctant to send their children to school for these reasons, but it was rapid and timely, and they could get feedback quickly. So I thought that was a very useful innovation that was used. Thank you.
Very useful innovation, and one that from which we can learn from the current situation. I have other questions here. Cesar has a question for Stephen, and it says, regarding procurement, some agencies are today relaxing procurement rules to facilitate rapid execution and response to COVID-19. Was this the case for the World Bank avian flu response? Would you be able to identify any shortcomings of this approach regarding integrity risk or other lessons in this regard?
Thanks, Cesar. So by and large, procurement rules were not relaxed for these projects, right? The avian influenza response is was a relatively sort of slow-moving crisis, in that this was happening in outbreaks kind of over the course of years in various countries, right? It wasn't the sort of immediate urgency we have now. I recall there was one particular waiver where that was required in order to allow some of the kind of direct hiring of work to be done by other UN agencies, and so there was an exemption there. But otherwise, kind of standard procurement rules were followed, and so if anything, kind of the integrity risks were taken seriously. The kinds of things that often came up were particularly around procurement for laboratory equipment, right? So highly technical, specialized goods. And what would often happen is that these projects were being run by technical experts, right? So by veterinary health specialists or doctors, laboratory testing experts, often not with procurement specialists in the projects. And so often what would happen is that they would go and they would try and sort of purchase the equipment that they were familiar with, that they had been trained on, or that they had sort of heard was the best in the world, and so forth. And so would put out very narrow procurement specifications when something much more general was really kind of what was appropriate. And so what happened then with procurement rules is, so those very specific requirements excluded many potential bidders, and led to many complaints, investigations from the World Bank's Integrity Unit, retendering of bids, and a general slowing down. So, I think the lesson there is just about the really needing procurement expertise involved in project implementation units, even in what were by World Bank standards still relatively small projects, because of the difficulty and complexity of the equipment being procured. I think the other thing is that many of the technical partners felt that the World Bank's procurement was relatively slow, and it probably was slower than what they would have been able to do themselves by just going out and purchasing equipment without going through procurement and tendering processes. But the procurement processes did mean that there was transparency, there was recourse to complaint and so forth, and in the end, transparent processes that I don't think had major integrity risks arise. Thanks.
Thank you very much, Stephen. Of course, this is always a key question. I have a question from John to all panelists. It says, given that we have relatively inaccurate and incomplete data on COVID-19, how would you go about determining baseline values as well as the quality of research indicators used for projects focused directly on addressing the spread and treatment of the pandemic? Did you have similar challenges on data reliability in your evaluations? And if so, how did you address them? Beth, please.
Well, I guess what I would mention there is that one of the sorry, I'm not going to give you an answer. I'm going to sort of elaborate on the problem or the issue. But one of the things that we grapple with is the fact that we have a lot of monitoring data, but it stops at the output level. So we really have no systematic way of knowing what the outcomes of our interventions are. I mean, not to say it doesn't happen on a sporadic manner, it does, but it's not done systematically. Nor are our evaluations resourced to be able to collect data of that type. So we find ourselves in a rather difficult situation there. And we are indeed currently experimenting with a number of different types of platforms to collect information from communities directly that are different from the ways that we've done this in the past. But I think that the questioner raises a lot of very pertinent issues. Thank you.
Indeed. Stephen, please, would you like to share your experience?
Sure, thanks. So avian influenza, I don't think we had huge data quality problems, certainly not the kind of uncertainties that are happening now. I mean, I think it's certainly known that there were, I'm sure, many poultry deaths and you know, small outbreaks and things that kind of that weren't picked up, but missing data quality wasn't the major problem. The major kind of problem that a lot of projects had with indicators was in part a couple of things. So one is that they tended to assume that there would be, you know, they tended to set up project results frameworks, assuming that outbreaks in that country would happen, whereas many of these projects had been designed as being kind of risk reduction and prevention projects, trying to build capacity in case, you know, more serious outbreaks began and occurred. So many of the projects existed in countries where an avian influenza outbreak turned out not even to happen. And so then, you know, project results frameworks were kind of unhelpful, and the indicators didn't give anything or didn't give any meaningful impact or assessment on the extent that capacity improvements were being made. You know, it was very hard to judge success of those projects or not. A lot of projects also did have very output-oriented kind of, you know, indicators. What the advice, you know, that we gave, so similarly, it's not really going to be useful necessarily to be trying to think about, you know, high-level outcomes in terms of, you know, is the outbreak successfully controlled by this case, you know, by this date, or what will the number of deaths be in total, or things like that. It's useful to track it, but you know, not necessarily useful for utility along the way. So a lot of the advice that we gave was to try and be using more intermediate outcomes, looking at the effectiveness of processes and the performance of systems, right? So are surveillance systems functioning? Where are you getting samples being collected? Was reporting happening? Were you getting samples that then would go to laboratories, right? Were diagnostic systems functioning, right? And at what kind of speed? So what would be the turnaround from sample collection to reaching a diagnostic result, and then was that loop closed of the result being reported back to the systems in the field and so forth? How well were the systems kind of interacting? Something like that is useful, because even after then the outbreak response, you're going to get some evidence. So even after kind of the crisis phase passes, you're going to have some useful evidence around that sort of sustained performance of systems, whether they are feasible to be continued, or whether they're just kind of you know, interest wanes and ability to process samples and tests and things collapses afterwards. Thanks.
Thank you. I don't know, Maya, if you would like to share your views with regards to this point.
Yeah, I don't have anything from the past to share with you, but I can tell you what's happening at the ADB now as the programs are being approved. So quite sensibly, the Strategy and Policy Department at ADB has actually prepared some good guidance on what sorts of indicators to use, and then also given some flexibility to adapt, you know, as the program's being implemented, because this is a very unusual situation. And as I mentioned earlier, so ADB support is not just to save lives, but also to save livelihoods. And there's also some budget support. So there are some areas that we can track more easily than, you know, on the public health side. So I think given the combination of support that ADB is providing in this particular instance, and the bit of flexibility there is in actually adapting the indicators. And I think, as Stephen mentioned, there are some good process indicators in there, some intermediate outcomes that could actually give us a pretty good handle, even if, you know, we don't have really good baselines to start with. I think we'd still be able to say if we got good results or not. And I think the fact that we are also, you know, very actively in the process of planning real-time evaluations, I'm hoping some of that will also provide some guidance in terms of making adjustments during the course of implementation. So I think with a combination of all of these types of things, we should have a pretty good handle on what results we're getting, or, you know, at least in the short term, and then sort of adapt along the way. So that's just my response based on what I'm seeing within ADB at this point.
Thank you, Maya. It's interesting to know what it's being currently done in other organizations. But on this point, I have another question. I have a few questions, but this one is linked also to something that Stephen mentioned in a certain way before. So I have a question from Mattia, which says, the very rapidly unfolding events, such as pandemics or natural disasters, require preparedness plans. My understanding is that countries generally have such plans in place, though the robustness certainly varies. I am wondering to what extent multilateral institutions that are mostly or solely addressing development and not humanitarian aid have established or can establish effective and efficient internal processes, plans, and institutional arrangements to quickly respond to low frequency but high impact events as pandemics. One thing is having the right lending instruments. The other is to have an institution which is ready to respond to situations which are generally at the fringe of their business, if at all. Would you have any comment to share in this respect? Would you, Beth, start, and Stephen and Maya?
Well, I guess I have a couple of reflections on that question, which is a very good one. UNICEF was engaged in a process of really trying to integrate our humanitarian and our development programming more closely together and to better understand, how we can best do that across country settings. So in some ways, I think that this crisis is putting pressure on that movement and that initiative. And there's a lot of questioning already within the agency about, which tools should we keep, which should we use, how should we meld them? But it's actually now beginning to cross that divide, so to speak. The other point that I wanted to make dealt with the questioner's reference to public health emergencies and natural disasters. And I think what we need to bear in mind is that a public health emergency is distinctly different from the other types of emergencies that we deal with. And then the question becomes, and this was something that we saw very much in the prior evaluation of Ebola, the question very much becomes is, are those tools that exist for emergencies such as hurricanes, earthquakes, civil war, are those tools and processes fit for purpose for public health emergencies, where your emergency can move very rapidly from one community to another or one region to another very quickly, as opposed to it being relatively contained? An earthquake happens in one place and you organize your response around it. So we're really looking currently at the tools and processes within the organization and how they can be better fit for purpose, both in terms of preparedness and response for public health emergencies. Thank you.
Thank you. Stephen?
So, I mean, for me, I would say for, the World Bank in particular, but others as well, I think we're really good at response. I don't think response is our problem, right? So I think that we do have those kind of processes and plans and institutional arrangements to try and respond quickly, even to like major shocks and massive events, right? Where, the management team from the senior management level gets behind something critical like this, that cascades down very, very quickly. And through the institution, it's an all hands on deck top priority. I mean, I was talking to people in various different sectors, right? Is part of kind of trying to brainstorm about our evaluation work program and, and asking them kind of what their thinking is. And in all sectors, including in infrastructure and transport and water, right? They're all thinking about kind of COVID response things and what's critical for them as well, right? In terms of what's going to happen to the utilities, right? If you have large scale kind of non-payment from people, right? But you're also not going to be wanting to or willing to disconnect customers. So I think we're very good at that. I think we're also good at being, so I mean, I think we have the instruments, right? So we have a large number of different kind of instruments and things. So we have budget support instruments that respond very quickly. We have restructuring of existing portfolio and programs that can happen. One thing in particular that's sort of, I think is being used in this case is something introduced some years ago called Contingent Emergency Response Component, which is kind of a dummy component in projects for emergency response purposes, so that if a disaster or emergency strikes, funds can quickly be reallocated out of other kind of components into that emergency response to support emergency response in that sector. We have new projects that are coming. I've seen, there have been a number of projects going to board approval in 2 weeks, right? For an institution that sort of 6 months is normally kind of fast, or, sometimes it can be a year or more in preparation. We have, funding windows, right? So like under the International Development Association, IDA, the low-income country part of the World Bank, right, has a crisis response window that's been established, because this kind of resilience and crisis response has been a major corporate priority for IDA deputies and for the World Bank for a long time. And finally, I'd say, so in terms of entering new areas, I think there has been a willingness to do that, right? One example has been the increasing involvement of the World Bank and around the kind of humanitarian development conflict nexus in partnership with a lot of UN agencies, where the World Bank's played, I think, a really valuable role, and there it's sort of stepped outside its comfort zone and been scaling up significantly in sort of fragile conflict and violence affected situations in countries. But I'd also say that, COVID response is not at the fringe of our business, right? There's a health response aspects, but there are the economic poverty development impact of this is going to be huge, right? Responding to that's our core business. So I think that this is very much something that the institution has unified behind in developing a massive response. I think it probably helped as well that there was recently a capital increase, as well as the largest IDA commitment program kind of ever. So the World Bank is in a financial position to be able to scale up and commit a lot of funding quickly as well. Thanks.
Thank you, Stephen. Perhaps Maya wants to share your thoughts about the Asian Development Bank.
Sure, I can do that. So very similar to the World Bank, as a multilateral development bank focusing on the region of Asia and the Pacific, we also have a mix of instruments and modalities and funding sources to mobilize large amounts of money fairly quickly. I think I mentioned earlier that that ADB has already approved about $9 billion worth in just a couple of months. So and then I think we have up to 20 billion that can be programmed at fairly short notice for the rest of the year if necessary. And as Stephen mentioned, yes, I think the longer term challenge is really going to be recovery post-pandemic. I think that's where our expertise lies, and that's where I think we can add real value. During the very early phases when we are responding, obviously we rely quite heavily on technical partnerships, with UNICEF and the WHO and others who have more in-depth expertise than we do. So we leave that bit to them and partner with them, and also partner with whoever we can in countries where it's appropriate. So I'd say, yeah, I think ADB has been able to respond very quickly, as it has in the past to other types of disasters. And we do happen to live in a fairly disaster-prone region, so it's something that ADB is used to responding to, and I think will continue to do so for as long as we exist as an organization. Yeah.
Thank you, Maya. Thank you. I think we have time for one more question. This is close to one of the questions we have had. I would like to ask you if, thinking back on your evaluative work, what suggestions, what advice you would have for evaluators who would eventually need to evaluate the various organizations' response to the COVID-19 crisis. And I guess you saw that one coming. Beth, would you like to start?
I guess I would say don't wait until it's over to perform something which is purely a summative exercise. I mean, I really feel that as evaluators, we have a responsibility to provide you know, rigorous information to the decision-making processes that are underway. So I can remember when I managed the Ebola evaluation, you know, coming on board in 2015, going immediately to the field and realizing you should never do an evaluation of an outbreak like this after the fact. It was just simply too late to be able to pick up on all of the important adaptations that had been made and the new issues that were emergent throughout the outbreak. You can't capture the nuances of that when you're working in a summative mode. So I guess I would put that out there. Thank you.
Thank you, Beth. Stephen?
Beth took my first point. So I agree completely, right? There's a real need for real-time evaluation, trying to support course correction. Really encourage us not to think of evaluation as something that just takes place at the end of the process. Look for ways wherever possible to support it upfront and during kind of projects in this rollout. This maybe requires some kind of different thinking, particularly from our independent evaluation functions like ODE or here in IEG or ADB, for us to be thinking differently about what kind of independence looks like. But secondly, I would say then there is, I think, still some value of something at the end, not necessarily kind of from the project by project, blow by blow level, but more from the you know, strategic perspective, right? How did we get here? How well prepared were we as institutions? You know, in terms of some of these things we've been already talking about, you know, instruments, processes, flexibility, monitoring and evaluation systems, but also the kind of, you know, what's needed in the future, right? What kind of things and actions have to take to minimize the chances of something like this ever happening again? How, you know, what are the sort of gaps of building capacity, and are we, you know, sufficiently able to be doing the first steps of risk reduction in our emergency response kind of operations, but also to be setting a path for pandemic vulnerability reduction further into the future. So, you know, what needs to be different in the future, right? Like, why have sort of One Health, you know, concepts like One Health, right? Trying to link animal health, human health, environmental health, you know, failed to gain traction, right? Have we sufficiently able to work across these sort of sectoral boundaries? Are we more, or do we more think here's the health space, here's the, you know, animal and agriculture space, here's the, you know, wildlife space? So for me, that's what a more strategic terminal evaluation would look like. But that can come, you know, a couple of years down the track, once, you know, we've really had time to sort of see what's going on and move past that emergency crisis phase. Thanks.
Thank you, Stephen. I agree that there is also value on trying to think more strategically to understand where we are and where we should be the next time. But Maya, would you like to share your thoughts on this point?
Okay. So in terms of, you know, suggestions or advice for evaluators who need to eventually evaluate the response to COVID-19. So really plan early, keep track of the institutional response to the crisis, not just the financing, but also the process. And prepare, you know, as Stephen said, and as I said earlier, prepare for real-time evaluation, mainly to gauge the likely effectiveness of the responses while they are being implemented. So really intended short-term results, and then how to create the conditions to resume development in the longer term. So that's sort of my short answer.
Many thanks, Maya. If I were to wrap up all the extraordinary insights that you have shared with us from 3 different and complementary organizations. I'll perhaps start with the need to be prepared for the future, both as institutions, but also for the countries. And as Stephen said, it's not that we don't know, it's not that institutions of the countries don't know, but there are conflicting priorities. So there are systemic factors, but still, seeing how these type of crises are evolving, how certain regions are prone to certain crises, and seeing the increased frequency of those and the larger impacts that they are having, that's something that we need to ensure. And if we do an evaluation, we need to make sure that we are drawing lessons so that we can stay prepared. That would imply a second point, which I find is important, which is the one about knowledge sharing. Both international cooperation continues to be fundamental, but also within the regions because of the similitude of the situation of the different countries. So those levels are extremely important, regional and global. So we will continue putting our small contribution as evaluators and exchanging between us and making sure, and we know they do, our institutions as well. But perhaps focusing more on the responses themselves, 2 elements that struck me quite, 3 elements that struck me significantly was, on the one hand, there is this need to focus not only on the infrastructure, on the equipment, on the material, on the hard things, as Steve mentioned them. But we need to focus also on the systems, on the resilience of the systems. We need to contribute to build systems that are resilient for the future crisis. And on that sense, it's interesting how our institutions have moved from ex-post instruments, for example, to ex-ante. So that induces to have certain or more strong preparedness. The other element is, and that's, I think, is key and it's very important for COVID-19, is the need to identify and focus on those groups that are most vulnerable, those that are disproportionately affected by the disease or by the crisis. So that's that's one of the priorities for the IDB, I'm sure your organizations as well. But in every country, we should try to push this focus because not all groups are affected in the same way. And of course, the third point is what happens after, is the reconstruction that needs to take into account all the learning from the other phases, and that needs to be geared towards a more resilient systems. Perhaps the last point simply is for evaluators and how we need to adapt, how we need to change our methods, and how we need to try to draw lessons in order to support the institutions and the countries to be better prepared. But with that, I would like to thank our panelists for their time, for sharing with us such interesting and valuable insights. I also like to thank our audience today for the questions, for their attention. And with this, we will close this virtual seminar, this webinar. And I wish you all a very good rest of the day. Stay safe. Most important, stay safe. Thank you very much.
Thank you, Ivory.
Thank you, Ivory.
Thank you so much, everyone. Bye now.